So up first, in terms of the actual talks, is me. So today I'm going to be talking about the work I've been doing in regard to emotional disorders, primarily anxiety, but we've been doing a little bit in the depression domain. So I'll just open with this illustration I made during my PhD in regard to what we think we know about anxiety. So, you know, there's lots of different flavors of this, but our kind of foundational models of the neurobiology of anxiety kind of posit that it's an evolutionarily adaptive state there to help us seek out, detect, and identify potential threats in the environment. And in order to do this under a state of anxiety, a broad array of cortico-subcortical circuitry tunes perception and cognition to reorient attention to help us detect these threats, and we call this threat vigilance. But in addition to tuning perception and cognition, these circuits may also communicate with peripheral physiology, namely the autonomic nervous system. So we see things like increased heart rate, which provides oxygen-rich blood to skeletal musculature, which facilitates defensive behaviors like fighting and fleeing. And the idea in theory, very much in theory, is that this all culminates in the instantiation of subjective experiences of anxiety. So back when I was in London, a lot of my PhD work looked at extending the anxiety literature to movie-watching paradigms. Here I did some work looking at individual differences in anxiety or trait anxiety and face perception during movie watching, and we see some effects that slightly differ to the traditional literature. Likewise, looking at individual differences in threat vigilance and functional connectivity during movie watching, and indeed when compared to rest, we see a much wider array of functional connectivity measures associated with threat vigilance during movie watching compared to rest. So clearly it's eliciting some unique idiosyncratic responses relevant for anxiety. A huge interest of mine as well is brain-heart communication mechanisms, which I've done just a couple studies on, but Soldob's going to be speaking a lot more about this afterwards. So instead, I'm going to talk a little bit about something I've been thinking about the past couple years on rethinking how we're using naturalistic neuroimaging. So if our goal is to map the brain the same way we're trying to map the globe, maybe one analogy we can make is that with our task designs, we are taking a pair of binoculars and looking over in a city, looking for transient changes in the weather, traffic, the development of buildings. Whereas maybe with resting state designs, what we've been doing is trying to carve out these broad landscapes, map out these kind of overarching mountains of the brain. And I've certainly been guilty of this. Maybe I'm pretty late to the game realizing this, but taking the pair of binoculars we've been given with movie watching designs and going to the same locations and more or less looking at the same things. But instead of just using this pair of binoculars to try and capture the same things, maybe we can actually be asking unique questions with this new paradigm we have. So instead of looking at the cities or the mountains, maybe we can be looking to map out the coast, the beaches. And specifically for my area, asking what else can we be doing for psychiatry with naturalistic neuroimaging. So this brings us to what I briefly mentioned before on this purported association between the brain circuits we see during traditional anxiety paradigms and the instantiation of subjective experiences of anxiety. And this goes back to a very key challenge that has plagued clinical neuroscience for decades, in that linking brain function to feelings is really challenging. Many years ago, we tried it quite a lot, and sometimes we would see stuff, sometimes it wouldn't replicate, or sometimes we would see things, but then when we tried to translate it clinically, it just dissipated. And the idea of like the amygdala as a fear center has been a kind of huge example of that. So what we've needed is a bridge to link these two channels of data. And the classic approach we've taken in neuroscience is to use laboratory-based measures of behavior to link brain function with self-reported feelings of anxiety in order to understand these symptoms that patients come in with. And using this approach, we've built up these kind of foundational models of the neurobiology of anxiety, which seem really clean when you read it all on paper, But if they're supposedly so clean, the question we have to ask ourselves, we do need to think about clinical impact. We have to ask ourselves, why has therapeutic discovery been so challenging for emotional disorders? Psychiatric illnesses in general have the highest fail rate out of most drugs, and emotional disorders is a particularly challenging area for this. And there's many reasons for this. One of which I would argue is that actually what we've ended up doing is not using laboratory-based measures of behavior as a bridge, but instead many of our models are just surrounded by a tight linking between laboratory-based measures of behavior and brain function. However, the association between behavior with self-reported feelings and brain function with feelings remains tenuous. For any of you who are clinically oriented in the audience, you may say, okay, sure, but behavior is clearly important clinically. Do we really need self-report? For example, if you have a patient with anxiety come in, you find out they're avoiding social situations. Maybe you try and interrupt those avoidance patterns. And by changing the behavior, you see a relief in the symptoms. So is this something actually we really need to study in neuroscience? There are two things I would kind of say when considering this. The first one is that self-reported feeling states aren't going anywhere. To quote my boss, Danny, self-report is here with us to stay, for good or bad, and I say mostly for good. However, it clearly has limitations, and failure to fully appreciate and confront these openly as a field have led some of the movements away from them. This brings us on to quite an influential paper from Vincent Taschereau, Dumichel, and colleagues, in that we should be putting the mental back in mental disorders. And the idea here is that over recent decades, we've ended up sidelining subjective self-reported measures of feeling states and kind of overemphasizing things like defensive behaviors in anxiety research. And this is both at a psychological level, but also kind of assuming that the same neural circuits which drive defensive responses are also the same circuits which instantiate subjective experiences of anxiety. And the conflation of the two may have contributed to some of the stagnation in the development of novel therapeutics. Fully agreeing with this, me and my colleagues wrote an opinion paper recently wherein we agree with a lot of their sentiments, but also highlight, we have tried this in the past, this is something we previously did, and there's a reason we moved away from it. And so maybe instead of just trying this again with slightly different measures, maybe we need a new platform to effectively address this gap. And perhaps movie watching paradigms are an effective tool for actually probing these rich subjective experiences in a clinical setting, because they can really personally resonate with patients on a very kind of specific level, exploring themes of things like social alienation, grief, loss, and more. So this brings us to the main study I want to talk about today on linking subjective experience of anxiety to brain function using natural language processing. So for this, we used something called the Francis dataset we collected at the NIH, wherein we had 48 healthy volunteers, 36 patients with anxiety. They came in for an array of clinical assessments, including self-report, parent report, clinician report, and measures of anxiety, depression, etc. They then underwent functional MRI, specifically rest and movie watching scans. The movie watching scan was a clip called Francis. It's a short animated movie about a girl who goes out on a boat late at night in Canada, and on the lake she hears knocking, and eventually she's captured. And both with subjective and physiological measures, we see higher self-reported anxiety as well as physiological arousal. Outside of the scanner, they were taken out, and then a research assistant asked them a series of questions about what they thought about the movie, and just recorded these on an audio recording device. So as for our fMRI data, everything I'm presenting is all pre-registered, and I typically split this into kind of two areas. One is primary hypothesis testing. So here we just focused on some of the classical areas implicating anxiety, namely subgenual anterior cingulate, dorsal anterior mid-cingulate, anterior insular, all of which were defined using meta-analytic clusters. And then lastly, amygdala defined using subject-specific free surface segmentations. As for our exploratory analysis, we expanded this to a whole brain level, but collapsing it into 7 networks just for statistical testing. As far as the interview data is concerned, we focused on 3 prompts. One was recall, can you tell me what happened in the movie? The other was positive appraisal, what are some things you liked about the movie? And negative appraisal, what are some things you did not like about the movie? Now, these were all transcribed by 2 very patient research assistants over the span of several weeks. And then the text from these were inputted into natural language processing algorithms, the first of which was the universal sentence encoder to give us sentence embeddings. This is just a vector of length 512, which captures kind of high-level abstract semantic concepts. And the second of which was VADA to run a sentiment analysis. This just gives us a score between -1 and 1, referring to the valence of their language. Now, the features of these 2 actually only correlate between about 0.1 and 0.3, so we're clearly capturing some sort of unique variance with these. We end up with 6 output variables regarding both content and valence for each of the prompts. Now, I will clarify here that recall content is not recall accuracy. It's not how accurately they recalled the movie, rather it's the type of things they spoke about when referring back to the movie. And this was of particular interest for me because this is the cornerstone of a lot of psychological therapy, wherein a patient will come in and you're kind of talking about the sorts of things they're referring to with prior events. We all inputted this data into an inter-subject representational similarity analysis framework, wherein just for each region, we calculated kind of measures of synchrony, just how correlated was the activity in one participant with another participant during the movie. And using this framework, we correlated these pairwise measures with also pairwise measures in anxiety symptoms, as well as with the interview data to look at individual differences. Just a few highlights. The first was that with the interview data, we found preliminary evidence that anxiety and age appear to shape how participants negatively appraise the movie. So when pediatric patients with anxiety were asked what are some things you did not like about the movie, we saw a negative association between the valence of their response and age, such that as patients got older, the kind of emotionality of their language became more negative, and we did not see this effect in healthy volunteers. Now, here are just the correlations. This was a significant interaction effect. Now, at first, you might suggest, it kind of at face value, suggests that perhaps older patients were having a more negative experience, but we don't really think this. Instead, we sort of speculate that this actually may well relate to the development of appraisal mechanisms, the development of language for talking about emotions. That's one thing. The second thing is a lot of the natural language processing algorithms aren't calibrated in an age-specific manner. Lots of them are trained on adult data and data from the internet, so they may be less sensitive to picking up some of these effects in younger children. The second thing we saw was that insular activity seemed to be associated with the content of subsequent recall. So here, each data point is just a given pair of participants, and on the x-axis is how similar was their insular activity during the movie, and on the y-axis is similarity of recall content, so this is the cosine similarity of their sentence embeddings. And just here is a unranked bivariate association. The test statistics are adjusted for various covariates. But the gist of this is that insular activity during the movie seemed to be associated with the type of content participants later recall about the movie. We also, when we expand this out to the brain, we actually see quite widespread activity, namely in the dorsal attention network and somatomotor network. And then we can reverse engineer this into its constituent parts and look at the unique contributions from different regions. We see here things like superior parietal lobe and temporal lobe contributing significantly, but realistically no one region can really be implicated in this. Rather, widespread activity seems to be associated with the type of content participants recall. Now, this was exciting, but I will highlight here some of the links with psychopathology do remain a challenge, such that we see an association between symptoms and interview data, as well as brain activity and interview data, but this linking between brain activity and symptoms remains a challenge for us. So in sum, hopefully I've shown you that movies are an effective platform for studying the neurobiology of emotional disorders. They may be useful for generating insights into altered subjective states. Specifically, we've been finding that widespread movie-evoked brain activity is associated with the content of subjective reports. And hopefully I've shown you that natural language processing may be a useful bridge for linking brain function and subjective experience in clinical neuroscience, but strengthening the links with psychopathology remains our next step. So up next, we're doing a lot of work on methods development in regard to clinical phenotyping as well as the fMRI data, doing some work on refining our natural language processing pipelines. The long-term plan is to augment this within therapeutic settings, such as TMS and exposure therapy, hopefully in Australia. So at this point, I just want to give a very quick shout out to Sid Chopra, Liana Schmoll, and Ben Harrison, who've been helping me with my funding applications. We're waiting to see, hoping to move here early next year. So if any of you have any money or a job you'd like to give me, please let me know afterwards. And with that, I'll just end by saying thank you to my bosses, Katerina Kachansky and Danny Pine, my research assistants, and thank you all for listening.